I'm Boon Lim. I'm a cardiologist at Welbeck, and these are some of the questions that my patients commonly ask me. Today I wanted to talk about cholesterol, and the question you might ask is, what is a high or normal cholesterol level? Oftentimes the metric or the number that you will see from your GP is something called the total cholesterol. In general, a total cholesterol of 5 and under is considered good. Now, I like as a cardiologist to have a more nuanced view on cholesterol. And as we get more and more advanced in our analysis of the sub-fractions of cholesterol, we have to divide the cholesterol generally into good cholesterol, which is said to be the HDL, which is the high density lipoprotein. And in summary, it should be a value that's more than 1. And then we have the bad cholesterol, or the so-called cholesterol that promotes atherosclerosis, and that is called the LDL, or the low density lipoprotein. And if there's one number to take away from that confusing sheet of information that you get from your cholesterol test, it is the LDL. What value of LDL is too high? That number keeps changing, and frustratingly for you and even for cardiologists, with every advancing scientific publication, we appear to be shifting the goalposts lower and lower. So your GP, and in general within the UK network of primary care, LDL cholesterol of less than 3 is considered good. But in my practice and in most cardiologists' practice, if your LDL cholesterol is less than 2.5, it would be considered reasonable. Personally, I would feel that if you have other risk factors that drive atherosclerosis, such as you're a smoker, you're diabetic, you have a high BMI, then your cholesterol LDL level needs to have a lower target, and I would say less than 1.8. And if you've ever had a heart attack or stroke, then it needs to be less than 1.4. The lower your LDL cholesterol is, the better. Now, when it comes to what to do, if you are less than 40, is it important for you to be aware of your cholesterol? Yes, I would say more important than if you were younger. Why? There is a lot more to gain from having an optimal cholesterol and metabolic health profile when you're younger, because you have many more years to live. And can you check your risk at home? Well, we find it may be challenging for patients to really know how to check the risk at home, which is why we would always advise you to seek advice from a healthcare professional such as your GP, or book an appointment to see us at Welbeck.